Hey guys, and welcome to another episode of the Barenaked Health Podcast. On the line today, I have Dr. Alex Amaducci. Alex, welcome to the show. Uh, First time on. If you want to give everybody maybe just a little bit of a rundown on your background, a little bit of your health journey, whatever you want to start with.
Awesome. Thanks, Nick. Yeah, so as Nick mentioned, my name's Alex Amaducci. I am a physician by trade. I'm an emergency medicine physician, and I also do medical toxicology. I met Nick a few years ago when he helped me out from a physical therapy standpoint with my SI joint, and we've had a lot of conversations since then. But yeah, happy to be here. So thanks for having me, Nick.
Absolutely. So, Alex, actually, let's even start right there. What does it mean to be into toxicology within like the medical profession? Because I had no idea. Like I could have kind of guessed it before you told me at least some of it, but give everybody like the rundown so we kind of know we're all on the same page then.
Yeah, it's not one of the most common specialties. It's the best specialty. No, just kidding. But I didn't know about it until I was in medical school either. So, medical toxicology is a subspecialty, meaning that you need to do training in a primary specialty, typically emergency medicine or pediatrics, sometimes internal medicine. And then you can do 2 years of additional training. But what toxicology is really it's the study of medications, right? So medications, an overdose, withdrawal from medication, side effects of medication. We do the majority of substance use disorders, so we handle a lot of patients that have substance issues with alcohol, opioids, stimulants, benzodiazepines, withdrawal from all of those things, and then a lot of kind of plant and nature exposures as well. So snake bites, marine life, kind of you name it, anything you think poison control, you think toxicology. Kids get into weird things, bubbles, shoot, glow sticks, all that falls under the umbrella of toxicology.
The one thing you said snake bites there, Alex. I don't even know if I've told you this before. I remember patients of mine, a husband and wife, they do ultra marathons. So like they're spending hours running through the woods, right? Like long
Mhm.
time we're talking, right? And I remember her saying to me the one time, she's like, Nick, I was starting to get nervous about snakes, right? Like, because we were spending a lot of times like way in the backcountry. And she goes, I looked into it, and don't quote me exactly on the statistics here, but they're probably pretty close. 95% of snake bites are basically males between, I want to say 18 and 35, and from the wrist and below, right?
Yeah.
And you think about it, you're like, oh, so pretty much all snake bites are young guys trying to pick snakes up.
And there's usually alcohol involved, and we have something called the tooth to tattoo ratio with
Okay,
snake
all
bites. But
right.
yes, those statistics, and again, I don't know the exact percentage, but you're right. It's usually younger males who are intentionally trying to interact with snakes, and those are the ones that get tagged.
Now,
Um,
outside of that, though, what are you actually like, more commonly working with then? Because you did list off just a whole bunch
oh,
of
yeah.
things there. Like, what is either like what is it that you're either typically seeing, or what is something you actually really enjoy helping people with, or both even?
Yeah, so I would say about 50% of what I do is substance use disorder. And that just is our, some hospitals have addiction medicine. I'm also boarded in addiction medicine, but we do about 50% of the substance use disorder in our hospital. So these are patients that are coming in intoxicated. So we're either treating the acute intoxication or the withdrawal or trying to kind of link people to outpatient services. Like someone has a substance use disorder, they want to get help. What medications can we start them on? Where can we send them to? That's about half my practice. The other half is probably overdoses, right? So, and then this ranges. We have the 2-year-old pediatric exploratory ingestions. We have a bimodal peak in tox. So kids get accidentally getting into things, and then usually teenagers are more experimental, intentional ingestions. And then so that's probably the other half of what I do. A lot of people overdosing on antidepressants and or taking too much of XYZ medications, over-the-counter medications, Tylenol, Motrin, Benadryl, and managing those toxidromes.
So, all right, being a parent, then yourself too, like, what do you, maybe not even the conversations that you're having, because that's a whole other game. Like, what is your blanket like statement? Like, hey, guys, like, don't forget to do this with your stuff. Like, I know you're smiling, but that's also why I'm asking you because I think this is an important part of the discussion, right? Is like some people just leave stuff out and just don't know or
Oh yeah.
don't know what to do with things. Like, what are general recommendations on that for just maintaining a safer home environment?
Yeah, so I mean, I think my conversations were very different pre and post kids. So I have three kids, 8, 6, and 2. And I think until you've had a 2-year-old, your view of the world is
Yeah,
a little bit different. 2-year-olds are crafty. 2-year-olds can climb, they can get into things, they know enough to want to explore, but not enough to kind of refrain. No, but the conversation I typically have is that, you know, things are marketed very well nowadays, right? So one of the conversations I have very often is about pods, whether it's laundry detergent pods or dishwasher detergent pods. Um, they are marketed to look pretty, right? They have bright
yeah.
colors. They smell great. So in a kid's mind, it looks good, it smells good, it must taste good. Um, and kids can choke on pods, they can bite into them, they can get a caustic injury. We have a pod-free home because, those are one of the things that I've seen some bad outcomes. But the biggest thing that I just talk to parents about is you need to any medication, even over-the-counter medication, needs to be up away from where your kid can get it, whether that's a lockbox or a really tall height. And then any
Are there
cabinets that
medical
kind of,
lock boxes?
nope, you can get them. It could be a
Is it
tackle box, like a fishing tackle box. I mean, it
okay?
doesn't have to be anything. You could just go to Target or Walmart or kind of get anything.
Okay,
Just that it's an extra layer of protection. But
sure.
those are the kind of conversations I have when a kid comes in with getting into something, is just talking about how to prevent it in the future.
And I'm guessing, based on that conversation too, edibles too. Uh, that's probably something that should also be going in there because, hey,
Yeah.
if it looks like a brownie, tastes like a brownie, a gummy, a whatever, and
Yeah.
it's not just as simple as that, like those things need to be put
Yeah.
away too.
On the toxicology service, we see on average one pediatric patient a week in the pediatric intensive care unit as a result of marijuana ingestion. So whether it is exploratory, like a kid sees a gummy on the floor, or teenagers kind of exploring, this has been a huge uptick in the last, I would say, 5 years or so since marijuana has become legal. And every state's a little bit different, but in the majority, it's either medicinally or recreationally legal in most states.
It's even just
Um,
gotten easier to get a hold of. Whatever
yeah.
whatever the case is, like across at least the states, it's getting
Yeah.
easier to get a hold of, no matter what.
Yeah, and and then as you mentioned, right? So, and if you ever like look up the packaging, like we had a big Nerds rope epidemic a couple years ago, and if you look at
Nerds rope?
have you ever seen the candy Nerds rope?
No.
The candy Nerds,
Yeah.
and it's almost like a Twizzler, and then the Nerds are like around it. It's a
Okay.
brand of a candy.
Yeah,
Uh,
yeah.
so it's a typical candy. They were making Nerds ropes with about 500 milligrams of THC in it,
So going to the
and
moon. Okay.
yeah. And again, dose is the wrong word, right? Because if but a standard, I would say, amount that people use is 2 to 5 milligrams. And then you have one piece of candy that has 500 milligrams, or you have a brownie that has 200 milligrams. So that the amount that you're supposed to take is, here, have 1/24 of a brownie. No one can do that. And the problem is it doesn't hit you right away because you're eating it, right? So you have to eat it. It
Right.
goes in the stomach. You have to get absorbed. You're not going to even feel the effects for 30 minutes. So people either overdo it because they don't know how to eat an edible, or kids get into it, and kids are kids. Like I said, it looks good, smells good, must taste good, and it tastes good, and they're on the floor. And they have a breathing tube.
What? So I don't actually know. Like, what actually happens to younger kids? Like, what does this kind of look like?
Yeah, the problem with kids is that it's unpredictable.
Okay.
So some kids get very agitated. Some kids have seizures. Some kids and their heart rate's really high. Their blood pressure could be really high. Other kids just get totally knocked down. So they could be totally sedate. Their heart rate's really low. Their blood pressure's really low. They're not maintaining their airway. They need to have a breathing tube put in. But the problem with kids is it's really unpredictable, and you can kind of have, which is uncommon for a, a toxidrome, right? Like you can predict with, this medication, this is going to happen. With this medication, this is going to happen. This is just a very unpredictable course, which is even scarier. And it's
Well, and
long
it was just
lasting.
it
Yeah.
was completely unintentional, right? Like, even if I'm using like any type of plant medicines, right? Like, I'm in the state of mind, I'm in the setting. Like, I know what's going on. Like, I know shit's about to get a little bit crazy sometimes, right?
Yeah.
But knowingly going into a situation like that versus a kid who's just ingested something, and like you said, half hour, 45 minutes later, uh, this is like, and kids that can't necessarily communicate well yet either, right?
Right. Yeah. You're
We're
like,
not
oh, you're
talking
like,
even like 5, 6 who might be able to start like really having a conversation. This is kids that maybe are talking, maybe aren't even talking yet. Wow.
right.
Okay.
Yeah. So it's, I think that there certainly is a therapeutic use. I think that we've just done it backwards, where instead of doing the research, having quality control, then kind of putting it out there, everything is now legal. Now they're trying to go backwards and do those other steps, and it's really challenging because it's really hard because now it's out and about there, and it's, our poor little kids are getting exposed to it. So,
Well, and I think part of the problem here, Alex, that goes very much overlooked, right? So when we're talking marijuana specifically in this case, right?
mm,
It's like, well, a lot of the grow operations are either done indoors using high amounts of chemicals,
mhm,
toxins, right? So it's like these are very abnormal numbers. Like even just your standard like lettuce that might be like conventionally raised with like pesticides and herbicides has
mhm,
much lower levels of just other toxins in it than, so it might not be, let's isolate out the THC, right? Like that
right.
might not be the issue. Like it could also be all of these other toxins that are in it. And then let's not forget too, it's like if you're getting this from a guy who's got a guy like, and you're not getting it through like standard operations, like,
Mhm.
or depending on whatever your state is, right? People are paranoid. And if you don't think that, I forget who did the research. There's a big project. Oh, this has got to be a while ago, right? Um, psychiatry school had students carry around water and they watered plants with it. And then on a psych ward, they had patients carry water around and watered plants with it, right? Half the plants died immediately. The other half of the plants like were given love and just like flourished. And the only difference was the water, right?
Mhm.
So also just the energies that are being transferred, like this is all a serious thing. And now when you're talking a defenseless kid, like all of these things are just being bombarded on them all at
Yeah.
once. Like that's got to be a crazy experience.
Yeah, it's wild. And like you mentioned, you mentioned all the toxins and the chemicals, right? There's, I mean, cannabis now is much different than cannabis was 10, 20, 30, hundreds of years ago, right?
But even
Uh,
in the, no, no, even keep that shorter term, right? Like
yeah.
10, 15 years has been a rapid evolution in things.
Yeah, so there's synthetic cannabinoids because people are trying to evade drug testing. So that's its own set of problems, but there's just not a lot of regulation. And even the standard stores, the dispensaries that people go to, and the big thing is the THC versus CBD, right? So people, it's very easy to get a medical card. You go to these dispensaries, you may say, okay, I want this product that's 80% THC, 20% CBD, 70/30, 60/40. It works great for you. You go back 2 weeks later, you aim to get the same thing. It's not the same thing. Um, so there's just not a lot of regulation in general, but then translate that to, you know, it just being readily available and out for kind of kids to be exposed to it. It's a big public health issue.
So speaking of things that are readily available and a big public health issue, another conversation that we've had that I found wild was just with vaping.
Oh
And
yeah.
where you were talking like serotonin syndrome, right?
Yes. Yep.
Give everybody, let's start with just an overview of that, please.
Okay. So what is serotonin
Yeah,
syndrome?
start there, right?
Yeah. So we all have neurotransmitters. We have neurotransmitters that are excitatory. So they make you, they stimulate you. You have inhibitory neurotransmitters. They bring everything down. You have happy neurotransmitters, right? So serotonin, dopamine, those are typically our transmitters that make us happy. They're the basis for a lot of the antidepressants, right? So these medications are medications that keep more of the neurotransmitters in your brain, more serotonin. You can kind of associate serotonin with, happy feelings. But serotonin syndrome is when there's too much of that, and it kind of your body is in a state of excitation. So you can get very shaky, your heart rate can go up, your blood pressure could go up, you could have a seizure. So there's a lot of things that can cause serotonin syndrome. A lot of times it's the interaction of two medications, but certain mushrooms can be serotonergic, they're called, but vape solution is another big market that is unregulated. So when people when e-cigarettes were introduced, it was when people are trying to get off of typical cigarettes. They thought smoking too many carcinogens was not healthy. Let's transition to this, liquid nicotine, but again, unregulated, and now anything and everything can go in a vape. So when you say, so part of my line of questioning for every patient is, do you smoke? What do you smoke? Do you vape? What do you vape? Do you drink? What do you drink? Do you use any substances? What substances do you use? But if people can vape nicotine, they can vape THC, and the most kind of recent thing, I've only seen it a few times, is that people are vaping what they think to be mushroom products, but again, nothing is regulated, and they look like regular household products, right? So they might look like a USB drive or they look like a pen. And so it's a big thing in high schools right now, especially because it looks like, a supply you might already have on you. But the concentrations of nicotine and THC are really high in vaping, and then the liquid that it gets diluted in is unregulated, and people can have side effects of that as well.
Now, but the serotonin syndrome, like, how is that now? Why is this a problem with these products? Like, what is happening? Like, we talked of like the different types of neurotransmitters. Excuse me. Like,
Mhm.
why are people getting into trouble with this?
Well, I mean, serotonin syndrome in general, they just feel terrible when they're on it. But you're manipulating neurotransmitters in your brain, right? So um, it's not, and again, like it's supposed to
Which
be
we're
with
still
different
always doing.
medications, which
We're
we're
still
always
always
doing.
doing that. Yeah.
Yeah. But these are big swings,
Yes.
which is the problem.
That's the difference.
That's the difference. Yeah.
No, and
So,
that's what I think is so important to understand. Is like, yeah, you can you can eat some crappy food, right? And it's like, yeah, it's going to swing it a little bit one way. It might be feeling good like while you're eating it. And that's why you want to keep eating it because it kind of keeps you going. But it's
yeah,
just hard to ingest that much versus
right.
in these crazy concentrations of things now. It's like
Yeah.
hit, hit, hit.
Yeah.
All of a sudden you're just gone. And then without it now, the come down off of that is hard.
Yeah, yeah. I mean, it's challenging. It's really hard for people to quit, and they're starting so young, and that's the problem too. Is
Because you
it's
can get I don't know enough about vaping in general. I mean, you can get odorless ones, I'm assuming too, or are they all odorless? I don't even know. Like,
so I'm sure that there are odorless ones, but there's also ones that same thing. They come because you can get the refills that come in bigger containers. If you look at it, they have pretty colors on them, pretty scents. So same thing with pediatrics, right? All they need is literally one sip of a liquid containing nicotine, and then a kid could have nicotine toxicity too. So everything gets evaded by the FDA because all they have to put on it is not for human consumption and it doesn't have to get regulated. So It's
Yeah.
challenging.
Wow. And the internet is so massive. Just
Yeah.
it's just impossible to just track it all. There's just no
Oh
way.
yeah. There's no way. So the best thing I think, that I tell people about it, talk to your kids about it before it's happening. You know what I mean? Make them aware of why it's dangerous. You're not just being a nagging parent, right? Like these are real health things that until, you would have to unfortunately experience that you don't want to just avoid it if you can.
So even going off of that then too, um, I forget who one of the kids just asked me this week again, like, wait, why is it that you don't like us being on like computer screens all the time, right? And but I actually had part of this conversation that we just had, right? Like we're talking in a I'll say just drug standpoint, but it's like, okay, being on a screen all the time is just hits of dopamine, serotonin, like all these neurotransmitters are just getting jacked up from that. And
Yeah.
Max even asked me then too, because the YouTube Shorts. I think that's what it is,
Mhm.
right? Like
Yep.
what any of the ones that are just faster, right? So
Right.
it could be on that, it could be on Instagram, TikTok, whatever it is, but it's like boom, 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 boom,
Yep.
boom, just coming more and more and more. And it's like it's taking more and more hits off of a vape pen of some sort.
Yeah.
And I explained it to him, and I actually explained it really rapidly. And then I looked at him, right? And it was just kind of like, okay. And then I slowed it down again. But I intentionally did that because I wanted him to understand the amount of overload coming into the system there is just affecting the body in just
Oh
another
yeah.
way like that.
100%. And I think we've talked about this too, the book, The Anxious Generation, just about that effect on it's literally, affecting their brains. The screens, the inattention, right? A commercial, you used to watch TV for whatever, what it was, 10 minutes, and then you would have a 30-second to a 2-minute commercial. Now it's like you watch TV for 2 minutes on those shorts and then it changes to something else and it changes to something else and like
Oh,
your body
10
doesn't learn
seconds,
how to
five
have
seconds, Alex.
yeah
Yeah,
an
not
attention
even.
span. It's crazy. It's a different world.
Now, I don't know if this is in your field. Like, are you actually studying the brain then too?
No, I mean,
And or I didn't know
so
if yeah, or if like students are looking at that, or if anything, like if you're seeing getting to at least research anything like that, like just brain changes with what's actually happening.
yeah, I am not personally researching it.
Yeah,
There are people that are researching it, but it does. I mean, I think they show that it changes the way that those neurons interact and those neurons fire. And, it's just, it's challenging. We talk about this all the time, right? Like, go play outside.
it's still okay. You know what? No, here's what I want to ask you then, Alex. What are your and again, okay, let me preface this with this is not medical advice, right? Like this
Yeah.
is just us talking about it. Alex, if you're okay, here's how I'll say it. Alex, if you're addicted to something, or if your family member of yours is addicted to something, what are going to be some of those just general recommendations that you're going to be making?
That is a great question. So I think it depends on, well, I think the first step is always admitting it to yourself, right? So step one is kind of ownership. Um, I think the second thing, and again, this is just coming from a decade of experiencing of
Yeah.
helping people with substance use disorder, and you should always consult your medical physician to just, but I would say, taking ownership of the problem. I think understanding that recovery is not a one and done, right? It's a lifelong process. So even if you are sober and you're not using, you're always in recovery. Um, and then I think the third thing is like, putting in the work, right? So I have this conversation with people a lot, and there's a lot of different reasons that people use, and whether or not it's underlying trauma, genetics, circumstances, right? Those are kind of the three things that we always talk about that come together.
Alex, have I ever told you the best definition I've ever come across for addiction?
No.
Unmet needs for safe love.
Okay. Yeah, I like that.
That's I heard that along the way, and it's like it's an unmet need for safe love, and all of those things you already just listed, like those kind of fall into that, right?
Yeah.
Now, I'm sure I'll say the medical establishment doesn't like that because how do you actually study that, right? Which
Yeah.
I'm sure that there are possible ways that we could actually measure that objectively, uh, but people aren't going to want to do that necessarily. But I
Yeah.
wanted to put that out there because I still love hearing that, like that definition. I just fits so well, I think.
Yeah. No, I really like that because it fits, right? There's some void that some people are replacing with a substance. But and we have, there's certified recovery specialists. We have a couple that work on our team. I've learned more
Where
from
does
them.
that fall in the process then? Like,
Yeah,
okay,
so
they come to see you, you're like, okay, we got it now. What are the next steps as they're walking out the door there?
right. So my personal practice is I only work in the hospital. So we will see patients in the hospital, either managing the acute intoxication, the withdrawal. We help start patients on medications to help with different substance use disorders, but then we can link them to either inpatient or outpatient treatment. If they are if they're still in the hospital, our certified recovery specialists will go see them and help them kind of figure out what they need outside the hospital. And they kind of meet people where they're at, right? Do you like talking more one-on-one with someone, right? You'd be better off with a therapist. Are you someone that is more of a group therapy person? Maybe you should go to AA. What county do you live in? This is what's available. And they kind of like give them the realistic
Okay.
options, but they also just sit and talk with them and they just listen. Like, I think, there's a stigma against substance use that people are always trying to break down. But unless you're kind of comfortable talking with people about that, a lot of people still are not comfortable about it. So it's our CRSs just sit and listen to patients tell their story or explain what stresses that they have in their life that led them to kind of use. And I think sometimes that's a big part of it too, is just being a listening ear, and letting people offload. But yeah, I think what they've taught me is, ownership, lifelong recovery, and you got to put in the work. And I tell patients this all the time, right? Like, I don't have a pill that can cure XYZ, right? For whatever condition is. I can give you a medication that lowers your blood pressure, but you still have to do the diet and the exercise to make it go away, right? Like I can give you a medication that lowers
That's
your
a
blood
great
sugar.
analogy, though. That's a great analogy because it's like now
Yep.
we're just taking this away from substances in general, right? And
Yep.
it's like, oh, high blood pressure, very common to see.
And that's the exact analogy I use, right? Like, yeah, I can make your numbers go down, but unless you want to not have the diagnosis of hypertension, right? You need to put in the work. So those are the conversations I have with patients from that perspective.
Where is what's the I guess what's your magic wand? What's the missing link like in overall care right now, right? Because you just mentioned of like different stigmas on things. Like
Hmm.
what is it that you just think we're missing or what would you like to just like immediately implement? Uh I'll say obviously more like within your model, or you could just say like
Yeah.
this is over the world. Like I don't care what it is. Like what does that look like for you?
I think like preventative holistic medicine in general, right? So resources for that. Like it would be easy for someone to call up and say, I want to make an appointment with a therapist. I want to make an appointment with a psychiatrist. I want to make an appointment with a nutritionist, and there be availability and for it to be affordable or covered by health insurance plans. That's my magic wand, right? Because so many people say like, I use substances because my anxiety is uncontrolled or my depression is uncontrolled, and then you say, okay, well, let's find you a psychiatrist. And it's like, well, it's going to be 3 months and, it's out of network. And it's really hard for people to put all those pieces together because there's so many barriers the way our healthcare system is designed. So, I think a shift towards preventative and holistic medicine And I'm not saying like medicine medications, I just mean the approach
Yeah.
is, what's the missing link, right? We should have people that can, have personal trainers and nutritionists that are available to them, to prevent the high blood pressure, the diabetes, the, obesity, instead of just being like, this is, another one of our favorite topics, right? But here's your GLP-1.
Okay. What's coming out about those now?
They are, it's challenging. And again, because of the lens that I see patients through, right? I see patients in the emergency room. I see patients with medication side effects. So I'm seeing the patients that are coming into the emergency room with the abdominal pain, the pancreatitis, the nausea, vomiting, diarrhea. Um, you know, again, some other side effects, right? Um, but I think that they can be used as a tool when used correctly, right?
Okay,
So,
so no, let's take this step by step because I like right, like what is the correct use of this? Like
yeah.
where are we going to get the actual benefits from this and how does it go like step by step from there?
Yeah. So I think, like, right. So, say you have a goal of exercising more, right? But you have obesity and you have pain in your joints every time you move because of the obesity, right? Maybe that GLP can get you to a point where you've lost X amount of weight to then be able to be more comfortable in exercising. Um, but I think that again, it's not a magic fix. It needs to be done in parallel of eating properly, exercising, and figuring out how to modify your lifestyle to maintain that without being on the GLP-1 forever.
And unfortunately,
Because,
it's just
yeah,
some of it is still now here where you talked about like the education, right? All right, I have a handful of patients at least right now on GLP-1s, right? All right, did you have any breakfast? What'd you have for breakfast today? Like, so I'll just start. I don't lead with anything else. All right, so what'd you have for breakfast today, right? Some oatmeal, some bananas on top. Like, okay, you had like 5 bites of that, and you've just taken like carbohydrates and got absolutely no nutrition whatsoever on board, right? So some of it is also still just teaching you
yeah,
need some protein, like you need some like veggies in there, right? Like start with that. And it's like if you're still hungry, okay, go for the oatmeal. But like
right.
have the egg, have the 2 eggs because first of all, they're just not that hungry a lot of times to begin with. So, and I had this conversation with Thursday in the clinic, right? I said, I am waiting to see an explosion of osteoporosis and sarcopenia from this
Mhm.
because people just are not getting enough food. You're not getting
Yeah,
protein. You're going to be breaking everything down. I
yeah,
didn't look at the absorption rates, but it's like, okay, some of the big ones like the bone builders, they're probably not getting absorbed either.
right,
Uh,
right. Yeah.
this is
Yeah, so
going to
that's
be
the
a
challenging
problem.
part, right? I think it's a temporary tool is the way I would describe it. Because you can't just use it as a, well, now I've lost the weight I want to use, and so I can still continue the same patterns of, eating and movement as you once were and expect, permanent outcomes without being on that medication. But yeah, it's challenging. And I think I shared this with you. Um, but I had an 8-year-old come into the ER that we got consulted on that injected themselves with a GLP-1 because they were curious because they saw their parent doing it. And I mean, these are long-lasting injectables, right? So they're supposed to last a week. So, this is a kid. Kids don't have as good of reserves as adults do, right? They're not supposed to have your blood sugar drop, but who knows, right? Is this kid going to get nauseous? Are they going to vomit? Are they going to have abdominal pain? How long is it going to last for? So now and again, kind of in this whole other realm of what are the unintended, consequences of these medications being so widespread. Kids can, see their parents doing it and think it's, a normal thing to do and want to do it themselves.
That's
Um,
just wild, right?
yeah,
Like that's just hitting me there, right? As you're saying, it's like, yeah, I saw mom or dad do this, right? Uh, because of their weight. And it's like if this kid's either a little chubby or is like they've really overweight, like now they're starting to think like, yeah, I want that too, right?
Yeah. And I think they're even starting. I mean, I think they're even starting therapeutically to put some teenagers on it as well. So, it's hard because you're trying to balance that, they're trying to balance the issue of having so many chronic medical conditions, versus, a weight loss tool. But I think, like I said, it's a tool to have in your toolkit, but it's not the end all be all. And there are a lot of real side effects. It's not meant to be on long
Is
term.
it a cyclical use? I actually don't know enough about that. Like, is it 2 months on, 1 month off, or like a certain number of weeks or anything like that? Like, is there cycling of it?
I don't think that there's cycling. I think people use it until I think that there's like an introductory dose. And again, I don't prescribe it.
Right.
But I think there's like an introductory dose. They will
Yeah.
go up to a higher dose, but then once they start reaching their goals, then they are supposed to kind of start tapering off of it. But I don't think it's like an on-off thing. I think it's more of a consistent
Okay.
use.
I hadn't really thought about that. And I'm thinking of just uh, basically underground steroid use, right? Where it's like
Yeah.
it's always used in like a cyclical manner as your body is changing. Like, so it's you always want to be sensitive to whatever the medication is, right? And it's like in in that world, like that's what they're doing. I wonder if that would actually be something that would want to be looked at, right? Of like, oh, if you did it again, 8 weeks on, 4 weeks off, like, are you actually
Right.
much more sensitive to it then? And does it have better effects
Yeah.
rather than
Good question.
a year and a
Just
half
seeing it
before you?
indefinitely. Yeah.
Yeah.
Yeah. I don't know. I don't know the answer to that question. It's a good question. Um,
But then there are also just less side effects because of it.
right.
Yeah, there's I guess lots to could be looked into about that.
Yeah, for sure. But yeah, it's interesting.
So, Alex, I'm going to say just anybody in the emergency department in general, like stuff's coming in hot and heavy. Like some nights, like yeah, or days, whatever, might be a little slower, but other times it's just boom, boom, boom. I mean, people
Mhm.
talk of like, oh, I had to wait for this long, right? And how do you how do you manage that for yourself? Like both in the short term, like on a shift, but also then like long term, like how do you not let that get to you? Because there's got to be a
Mhm.
lot going on there based on just I mean, we've only touched on a couple different subjects, but there's a whole lot more than that coming through the doors every time.
Oh yeah. Yeah. I think when you are picking a medical specialty, right? People pick specialties sometimes for lifestyle reasons, right? And one of the things that people have always talked about with emergency medicine is its shift work, right? So when you're on, and you're off, you're off. And there's an element to that too. And then people always talk about balance. I don't, I think I've learned that there is not balance in the moment, right? So
Absolutely agree with you. Yes.
when I'm at work, I'm not a parent right then, right? Like when I'm at work, I want to be able to give 100% to work. When I'm at home, I want to be able to give 100% to home. And again, sometimes those lines blur. So, in the emergency room, and especially this is more true, I would say, for adults for kids, but you have to kind of um, emotionally limit yourself, right? So if I can be empathetic to a point, but I have to kind of put up some barriers so that it doesn't affect me too much, right? Because if every case to me was sad or hard or, you know, what have you, that would just drain me. So, I think that there's a certain element of some shields that you put up as an emergency room physician of like, this is a job, right? And then you can kind of leave more of the emotional stuff to, family or what have you. But yeah, I mean, it's busy in the emergency room. You see everything. And it, you try to give your full self to that patient in the moment, but at the same time, you could be called away to go deal with something else. I think some of the hardest transitions are when there are cases that kind of penetrate that shield, right? Like you might have a death on shift, or there might be something that resonates with you, whether it's for a personal reason or, it just touches a nerve and you have to recover in that moment and go see the next patient and kind of pretend like nothing happened. And those are some of the hardest transitions at work. And then outside of work, right, letting yourself process that, acknowledge it, process it, but then also move on because you don't want to carry it with you long term, because then I think that's how burnout happens.
Do you have any either personal practices or just things that you found well work for people as far as like that actual processing then for yourself?
Yeah, I mean, I have like a 35-minute commute, so like on the way home, like I usually use that time to reflect, right? To think about my, did I miss anything? Why was that case a hard case? A lot of walking and talking with friends, like, this case really sucked today. But like I said, like I think in the moment, sometimes you don't have a chance to give yourself that time, but to give yourself that time out of it and to acknowledge it, process it, but then move on. Is kind of how I approach it because it can be really hard. Um, and I think, once I had kids, pediatric cases were harder too, right? Because then you just picture your own kids in XYZ circumstances and having to kind of not do that in order to be able to function. But yeah, it's a tough
I mean, I
job.
could see that being a superpower for you though too, right? Where it's you're gonna almost be able to, hey, like I get what not just the child, but the whole family is looking at, or like
Yeah,
mom or the dad, both parents, whatever it is, whoever brought them in, right? Like you also have this now, like view of the situation in a better way, though, too. So
yeah,
you can actually use that in not in a like, oh man, like what if this is my kid? No, like this is still my kid. Like I'm just helping them out in a different
right.
way, right?
Yeah, no, and I'm definitely a better doctor for my own different personal experiences, right? Whether it's having kids, having going through different medical issues, having family members going through different medical issues, you definitely see a different side of things that lets you be a better, more empathetic, um, doctor, but it's still, you still have to recognize when certain cases strike a nerve, and to be able to kind of move on. But yeah, yeah, you're right. It's a benefit, it's a perk and a you know, and
Go
it's a
either
plus
way.
and a
Just
minus.
depends how you
Yeah.
use it. Um, Alex, what do you? All right, shift gears for a minute. What are you studying right now, and or like what are you working on? Because again, you're not just in the emergency room all the time, then, right?
Right.
Give
So
a yeah, give a
yeah,
rundown, please.
right now nothing, but I just completed my master's in business administration.
Yeah.
So that was my last year and a half of studies. Um,
So how was that shifting? Because obviously it's just a different. This is a different wheelhouse now.
yeah.
Like what was the motivation to do so? But then, like, what did you get out of it, really?
Yeah. Well, I think the more, I think when I've worked with in education, my role's shifting a little bit more to administration, but in education, right? I always tell people when you finish medical school, you've learned all this medical knowledge, right? Then you start your first year as a doctor and you spend the first 6 months of that being like, where are the bathrooms? How do I turn the computer on, right? Like, where do I park? What do I wear? How do I eat on shift, right? And you have this like whole shift of, I just spent 4 years studying all this medicine and I know it so well. And now that slate like shifts completely to a whole new steep learning curve. And then you spend your training kind of trying to integrate that too, right? In whatever specialty it is. And then you finish training, and then it's another shift of, well, I had supervision for 3, 4, 5 years, and now I have to figure out how to be a doctor on my own when all of the choices, all the decisions, all the responsibility is on me, right? And so, how do you practice in that landscape? Um, and then I think then you kind of reach a certain point of like, okay, I think I've gotten the routine down a little bit. Like, how else do I want to challenge myself? So for me, a lot of healthcare focuses on accessibility and costs and logistics, right? And there's a large scope outside of the actual medicine, right? Outside of the, okay, this person presents with chest pain. What do you do? Um, and so this was a way for me to kind of challenge myself and in learning a little bit more about that and how can I learn the system a little bit better, so that I could kind of better serve my patients and understand, right? Like understand where the hospital's coming from, where the patient's coming from, how do I offer them the best thing, having a little bit more of a financial understanding from that.
So I guess from that standpoint, like, what things are we doing right? What things are we screwing up? Like, do you see now? Do you see both sides of that war or
Yeah.
that kind of realm there?
It's insurance companies are really challenging. What they do and don't reimburse is really challenging. Access to consultants, right? Access to specialties is
What do you mean
hard. Kind of
consultants?
like, say you want to see a specialist,
Okay,
depending on that type of specialist, it can be months before you can get in with them.
yeah. Why? What? Like, okay, no, and I know there are probably lots of different reasons behind that, but Alex, I always tell people like I can see you within a day or two. Like it might not be the exact time you want, but I can probably fit you in, right? Like if you're
Right.
coming to see me as a physical therapist, like and somebody's like, man, this is killing me. Like it just happened. Okay, the sooner we can get to this, the better. Versus somebody
Yeah.
who's like, it's been bothering me for 15 years. If I have to wait 4 days, like no big deal. Okay,
Right.
like, I'll see you in 4 days. Like that's the perfect time for you. Good. Uh, yeah. Like what is it? What's going on there?
I wish I knew. I wish I knew because it's embarrassing, right? When you're like, you need to see this
Yeah.
specialist and we can schedule you in the next calendar year, right? Like it's embarrassing.
Yeah, like I'll see anybody in the practice, all 15 docs. Yep.
Yeah.
Yeah, that's the
Yeah, like
first
we'll put you
appointment.
on a wait list. Yep, yeah. I don't know. I don't know if it's I don't know if again if we go back to preventative primary care, if we need to do a little more, if it's a shortage of specialists, if it's a scheduling issue. It's a
No,
little bit
now
of all
I'm
of them.
wondering, are the okay, this I'm curious how this is for like physicians specifically, comparatively, because Alex, I could go out and get so many new jobs I mean, we're talking on a Sunday, I could be hired a dozen new places tomorrow, right?
Yeah.
It's that easy. Like there, and I mean that's just within like an easy driving distance if I don't want to commute. Um, there's so much availability in the physical therapy realm. Like,
Yeah.
is it the same way for physicians, or is it also, like you said, specialist dependent, right? Like, oh yeah, we have a ton of these, but we need more of these.
It is. It's a little bit, there are certain specialties that are much more challenging to get in touch with than others. So yeah, I mean, and it's one of those things too, right? Like everyone has so much access to information, right? So I always joke, Dr. Google, people come in all the time having, researched their own their issues and, everyone wants to see the specialist, which has its again, its pluses and its minuses. So are we approaching things like do we always need to see a specialist, right? Um, do we need to do that? So yeah, I don't know. I wish I knew, Nick. I wish I knew the
Well,
answer.
okay, you bring up a great, no, one of the things you just said there, because this is one of my, um, I'll just say theories, right? Like, I think um, general practitioners, and I don't know the number, I just always use 100. I'm like, they should have 100 patients, right? And some weeks they're going to work 15 hours, and other weeks they're going to work 115 hours. It just
Hmm.
depends how their patients are doing at that time, right? So it's like you're with them and they're directing care, right?
Yeah,
Like you can basically see them, like I said, it's within a day all the time. Like they always have space for you, right? Like because you're with them, right?
yeah,
Um, and yeah, like maybe I have one. And again, the last time I went to the doctor, like it's few and far between every few
right, right.
years, and it's usually poison ivy related. Uh, um, so that's what I mean. It's like those are the only circumstances in which I'm using it. So they want me on their caseload, right? Because they're like, yeah, I don't have to do anything, right? Versus
Yeah,
then they have somebody that balances that out with, yeah, they're in there every other day. Like,
right,
what is that? What that looks? But I also don't want people to just be like completely isolated and like, well, you can only go through your gatekeeper here either.
right. Yeah, no, and I think it's a combination of that, and I think, you know, uh, I think it has just shifted more and more away of, well, this is my primary doctor, right? Like this is my general practitioner. This is the family doctor. This is the person I go to. It's kind of like, well, today you get this person and tomorrow you get this person. And I think that there's a little bit of a lack of continuity. And because of that, I think that you don't develop that rapport as much
Yeah.
as people once did, right? Like, um,
Everybody
and
knew old Doc so and so around
right.
town.
Yeah,
Yeah.
exactly. Like he was the town doctor and you could call him for anything and he knew me. I'd walk in and he'd know my whole family and he'd know my
Yes.
history. And I think that we've gotten away from that personal touch, which then I think that if you don't have that rapport, then it's easier to want to get second opinions or want to get other opinions because you're only seeing like, different people in space and time versus like, okay, I trust so and so. He would never leave me astray. She would never leave me astray. Um, so I think that it's just been a whole shift in medicine in general of, you know, like you said, there's not variance anymore of really what people work. Everything is very, unless they're private practice, right? Everything is very rigid, right? You're going to work 40 hours a week and, you can either fit the number of patients in or you can't. Like, it's just much, it's continually changing for the better or for the worse.
Yeah, but no, that's still, I just like the food for thought sometimes on this, right?
Yeah.
Especially if you're coming out, like you said, of some of more of the administrative study on this for just health in general. Uh,
Yeah.
I find that interesting because I'm also just curious, like, okay, I know how I'm looking at it as a clinician, but what is happening on the administrative side? Because
Right, right.
I don't necessarily see that aspect.
Yeah. Yeah, I mean, and that's what I'm still learning, still trying to figure out, but um yeah, it's been interesting. It's been eye-opening, but that to answer your original question, that's what I had been, studying for the
Yeah.
last year and a half. Now I'm taking a little break.
All right. So another thing, because Alex and I'll talk sometimes just about like books, stuff we're learning. Like, are you diving into just? I mean, or is there just anything on your radar where you know what? Uh, I really want to look into. Um, I mean, I don't care if it's exercise, if it's nutrition, if it's sleep, if it's whatever. Like, is there anything that's just like on your radar that you want to take a deeper dive into just learning about right now?
Oh, that's a good question. I think one of the things is when I usually read silly stuff for, lighthearted, for pleasure, just because there's so much, my job can be sometimes so heavy. So, um, but I think, and one of the things that I'm always just kind of interested in and I want to do better for my kids always is just trying to just have a lead a cleaner lifestyle, right? So, what am I eating? How's my sleep hygiene? Am I exercising the right way? Doing it enough? So I can't say that I'm studying that too much, but I'm definitely uh, talking about it, thinking about it, trying new things as often as I can.
Anything that you've learned recently, like that you've just implemented, where you're like, you know what, this was a really good thing for me to do,
Um, and
or
it's
for your family,
ironic.
or for your
Yeah.
family too.
I think, sleep is a huge thing, and it's one of those things that I think I could, when I was younger, right? I could work a million night shifts and I could work all these crazy hours and get by on 3, 4 hours of sleep. And I'm really feeling the more that I've been doing this, that that's not the case. And I really need to sleep more and to sleep more regularly within the confines of my job to feel better. And that I see the biggest differences in my moods and my, eating patterns and exercise patterns when sleep is kind of the foundation.
Okay, somebody's coming out of med school right now. Like they're like, look, I'm working 12 hours overnight. How many nights a week? Like, how do they make that work? Like, what is the best possible circumstances in which they can do that? Or what are the things like you found where you're like, you know what? Here's how I made at least that, or would look back on it
Yeah.
now, or would look back on it like, here's what I would have done differently.
Yeah, that's called residency when you work 6 days a week, 12-hour days. I would say the biggest thing is, at that point, you're just surviving, right? So you are going to work, you're coming home, you're showering, you're going to sleep, you're eating. Um, I think one of the things that I did early on in residency was to join a co-op. So I was forced to pick up like fruits and vegetables every week. And they were sitting on my counter, and I was like, well, I got to use this, 12 pounds of lettuce. So I guess I'm having salad, right? But even I think making an effort to like meal plan, meal prep, have certain kind of healthy things, because it's so easy when you're tired and you're stressed to just eat crap. But to make it, and even if it's after work, before work, like 10, 15, 20 minutes of movement, just can make a huge difference. Even I try to, even if I've had like the longest, worst day, like taking 2 laps around the block just makes a big difference. So it doesn't have to be anything earth-shattering. I think little things that just add up over time.
And there goes back to just even where we're talking earlier of like all these things that we're addicted to, all of these issues with the medical system. It's like a little bit just like
Mhm.
goes a long way. Like just
Yeah.
start stacking those wins on a regular basis, and a lot of other things just tend to fall into place.
Yeah, for sure. Yeah. What do you think? What do you think someone who's working 6 days a week, 12 hours a day should do?
Okay, no, that I can actually answer very simply. Uh, I want to be clear. Typically, is it like 7 to 7?
You mean, yeah, days or nights, yes.
Correct. Like most places are all following that, as far as I know, right? Or
5 to 5, 6 to 6, 7 to 7. Yeah.
roughly, yeah,
Pick a
like
number.
close
Yeah.
enough where it's, yeah, it's not like 12 to 12 is what I'm saying, right? It's like
Yeah.
um sunlight and grounding. Look,
Yeah.
like I don't think it gets a whole lot more than that. I like we said, like prepping, like you need to be prepared. Like do not have the oh shit, like I don't have any food. It's not gonna work out well. Like you just have to know if you only have a chance to go on Monday mornings at 9 a.m., like because that's the way that your shift or like your schedule works, then you have to do it. You just have to make sure that
Yeah.
you get it and make the food. But getting actual daylight, like outside of a whatever, I'm going to just say whatever office you're in, whatever facility you're in, doesn't matter. Getting that grounding.
Hmm.
And then again, like you guys can't necessarily see my screen, but it's orange right now. Like it's crazy amber. Like, so anything that you can do to modify your screens, like I would be wearing blue blockers because most medical facilities are bright as all hell. And it's like at 1 in the morning, like that's not how your body's meant to be running.
Yeah.
So how do you do it? Like, but then now on the opposite of that, right? It's like invest in some blackout shades, right? Like you were talking sleep.
Oh,
Like
yeah.
you need to go sleep in a cave then when you go to sleep. Like don't
Yeah.
screw up your sleep. Like don't eat close to bedtime and just make it pitch black in there. I think like
I
a
was
couple
actually
of
going to
those
say,
things.
yeah, it sounds silly, but a sleep mask was one of the biggest things that changed my sleep quality. Because I am someone that needs to take a nap during the day or sleep during the day, or, and that has made a huge difference because we always did blackout curtains and sound machines and what have you. But a sleep mask, honestly, has made a huge difference in my sleep quality, especially when
A
it's a
couple
regular. Yeah.
dollars that can change like how much
Oh,
is that
yeah.
worth? That's kind of priceless right there, right?
Yeah, for sure.
All right.
So,
So I know we're kind of running close on time here. We're doing this between all kids practices, like
yeah, exactly.
making it work, right? Alex, anything that you just want to share with everybody, like any parting words, anything like that, please.
I think from a medical perspective, be your own advocate and carve out the time for you, right? Like everyone's busy, everyone has stress, everyone has life circumstances. But if you really kind of put your mind towards it, you can carve out the 20 minutes to work out. Like we talked about, you can, take care of yourself first because unless you do that, you can't take care of others. And that would kind of be my
No,
word of
okay. I
wisdom.
love actually that you said medical advocate, right? And then the things that you listed after. This also you didn't just say, "Hey, make sure you research this, make sure you talk to your doctor about this," and like ask those questions because I think that's part of it. Like that's a super
Yeah.
important part. But then also you just said make time for yourself. Like, hey, make sure you're making sure you get the sleep, the food, the exercise, right? Like
Yep.
that's part of your medical advocacy, which
Oh yeah.
I don't think the two go hand in hand. The advocacy part I always hear of like, oh, just as like maybe some research and like, oh, I need to get this test or whatever. But you're still your own advocate for all of those other things too.
Yeah, absolutely. I mean, I think that you need to be able to know yourself to advocate for yourself, right? And so if you're not taking care of yourself, then you can't, you might not have as much insight to like, hey, this is off, this is different, right? I need to then really kind of portray like, no. And again, like that for me, then it's like at the same token, listen to when people are saying like, no, this person's not like this, right? Like they normally can do XYZ and this is different, right? Because but I think that that starts with you, right? So you got to take care of yourself so that you can know yourself, advocate for yourself, and then take care of others.
No, that's beautiful. Absolutely. And recognizing and listening for it in others is
Yeah.
got to be a huge part of it on your end then too. Yeah.
Absolutely. I mean, and I mean, you're in the same boat, right? You're hearing people every day, right? This my knee's not right, my shoulder's not right,
Well,
right?
I'm
But
hearing about it in a little different context. You might be
yeah,
hearing about it from somebody one time you're never going to see again. You have to pick up
yeah,
at that moment, right? Like
yeah,
I'm doing it, I'll say just more over a longer term a lot of times where it's like rarely am I seeing somebody for one visit. It's might be 3 visits, it might be 3 months, right? Where it's like I
yeah,
have more of those opportunities. Not that I ever want to miss out on one, but they
right.
might be very different. But yeah, like always listening because sometimes there's something that a patient says. I'm just like, what did you just say? Right. And he's like, you
Yeah,
say it again because it completely changes the course of treatment and what they need to do.
right, right, for sure. But awesome. But this was awesome, Nick. Thanks for having me.
Excellent. Alex, I
Yeah.
thank you so much. I appreciate it.
Yeah, awesome. Well, enjoy. I think I'm off to practice next, so enjoy your reprieve.